Do you find yourself tossing and turning at night? Is it a struggle to wake up in the morning? You might be surprised to learn that you're not alone. Millions of people worldwide experience sleep-wake disorders. These disorders can have a significant impact on daily life. Understanding these disorders is crucial for improving sleep health. In this essay, we will explore the mysteries of sleep-wake disorders. Sleep is not a luxury, it's a necessity. It is the foundation upon which our daily lives are built, providing the essential rest our bodies and minds need to function optimally. It is as essential to our well-being as eating, drinking, and breathing. Just as we wouldn't skip meals or go without water, we shouldn't neglect our need for sleep. During sleep, our bodies and minds can rest and repair. This period of rest is crucial for muscle recovery, tissue growth, and the release of important hormones. Sleep allows us to function at our best when we are awake. A good night's sleep can improve our mood, enhance our cognitive abilities, and increase our overall productivity. Sleep is vital for our physical and mental health. Establishing healthy sleep habits, such as maintaining a regular sleep schedule and creating a relaxing bedtime routine, can significantly improve our sleep quality. It strengthens our immune system and protects us from chronic diseases. Adequate sleep helps our bodies fight off infections and reduces the risk of conditions like heart disease and diabetes. Sleep also plays a crucial role in learning, memory, and emotional regulation. It helps consolidate our memories and process our emotions, making us better equipped to handle daily challenges. When we don't get enough sleep, or if the quality of our sleep is poor, our health and well-being suffer. Lack of sleep can lead to increased stress, difficulty concentrating, and a higher risk of accidents. This is where sleep-wake disorders come into play. Conditions like insomnia, sleep apnea, and restless leg syndrome can severely impact our ability to get restful sleep, highlighting the importance of seeking medical advice if sleep issues persist. Sleep-wake disorders are a group of conditions that affect the timing, quality, and duration of sleep. These disorders disrupt the natural sleep-wake cycle. This can lead to various daytime impairments. There are many different types of sleep-wake disorders. Some of the most common include insomnia, sleep apnea, restless leg syndrome, and narcolepsy. Each disorder has its own set of symptoms and causes. These disorders can affect anyone, regardless of age, gender, or lifestyle. However, certain factors can increase the risk of developing a sleep-wake disorder. The causes of sleep-wake disorders are complex and varied. They can be influenced by a combination of factors, including genetics, medical conditions, medications, lifestyle factors, and environmental factors. Some people are genetically predisposed to sleep disorders. Certain medical conditions, such as thyroid disorders and chronic pain, can disrupt sleep. Some medications can interfere with sleep. Shift work, caffeine consumption, and alcohol use can all impact sleep. Noise, light, and temperature can affect sleep quality. Identifying the underlying cause of a sleep-wake disorder is crucial for effective treatment. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, commonly known as the DSM-5-TR, provides criteria for diagnosing sleep-wake disorders. Clinicians use these criteria to make accurate diagnoses. A diagnosis typically involves a detailed medical history, a physical examination, and sometimes a sleep study. Sleep studies, or polysomnography, monitor brain activity, eye movements, and other physiological parameters during sleep. Accurate diagnosis is essential for determining the most appropriate treatment plan for the individual. The symptoms of sleep-wake disorders can vary depending on the specific disorder. However, some common symptoms include difficulty falling asleep or staying asleep, waking up too early in the morning, excessive daytime sleepiness, restless sleep, snoring or gasping for air during sleep, unusual movements or sensations during sleep. If you experience any of these symptoms regularly, it is important to consult a healthcare professional. Early diagnosis and treatment can prevent the negative consequences of untreated sleep disorders. To understand the real-life impact of sleep-wake disorders, let's consider the case of Sarah. Sarah, a 35-year-old marketing executive, had always been a high achiever. She was known for her dedication, creativity, and ability to handle multiple projects simultaneously. However, over the past year, her performance at work had declined. She was constantly tired, had difficulty concentrating, and was prone to making mistakes. Tasks that once seemed easy now felt insurmountable. Sarah's personal life was also affected. She was irritable, withdrawn, and had lost interest in activities she used to enjoy. Her relationships with friends and family began to suffer as she became more isolated. Concerned, Sarah finally decided to seek medical advice. After a thorough evaluation, Sarah was diagnosed with insomnia. The diagnosis was a turning point for her. The doctor explained that Sarah's demanding job, long work hours, and constant stress were major contributing factors to her sleep problems. The lack of sleep was not just a symptom, but a significant cause of her declining well-being. Sarah's story highlights how sleep-wake disorders can have a ripple effect, impacting various aspects of a person's life. From professional setbacks to personal struggles, the consequences of sleep disorders are far-reaching. With the help of her doctor, Sarah began a treatment plan that included cognitive behavioral therapy for insomnia, CBTI, lifestyle changes, and stress management techniques. She started practicing relaxation techniques, maintaining a consistent sleep schedule, and setting boundaries at work to reduce stress. Gradually, Sarah began to see improvements. Her energy levels increased, her focus returned, and she started to regain her passion for her work and hobbies. Most importantly, her relationships with friends and family improved as she became more present and engaged. Sarah's journey underscores the importance of addressing sleep-wake disorders and seeking help when needed. It is a reminder that with the right support and treatment, recovery is possible and quality of life can be restored. The good news is that sleep-wake disorders are treatable. With the right approach and dedication, individuals can significantly improve their sleep quality and overall well-being. Treatment options vary depending on the specific disorder and its underlying causes. It's important to understand that what works for one person may not work for another, so a personalized approach is often necessary. Some common treatment approaches include lifestyle changes. Making adjustments to sleep habits, diet, exercise, and stress management can significantly improve sleep quality. For instance, establishing a regular sleep schedule, creating a restful sleep environment, and avoiding caffeine and electronics before bedtime can make a big difference. Cognitive behavioral therapy for insomnia, or CBTI. This type of therapy helps individuals identify and change negative thoughts and behaviors that contribute to insomnia. CBTI typically involves a series of sessions with a trained therapist and can include techniques such as sleep restriction, stimulus control, and relaxation training. Medications. In some cases, medications may be prescribed to improve sleep. These medications can be particularly helpful for short-term relief or for individuals with severe sleep disturbances. These can range from over-the-counter sleep aids to prescription medications. Over-the-counter options might include antihistamines or melatonin supplements, while prescription medications could involve sedative hypnotics or other drugs specifically designed to address sleep issues. Bright light therapy. This therapy involves exposure to bright light, which can help regulate the body's natural sleep-wake cycle. It's particularly effective for conditions like seasonal affective disorder, SAD, and certain types of insomnia. Sessions usually take place in the morning to help reset the body's internal clock, continuous positive airway pressure, or CPAP therapy. This treatment is commonly used for sleep apnea and involves wearing a mask that delivers pressurized air to keep the airways open during sleep. CPAP machines can greatly improve sleep quality and reduce the health risks associated with sleep apnea, such as high blood pressure and heart disease. Working closely with a healthcare professional is crucial for developing an effective treatment plan tailored to individual needs. A healthcare provider can help diagnose the specific type of sleep-wake disorder, recommend appropriate treatments, and monitor progress over time. Regular follow-ups and adjustments to the treatment plan can ensure the best possible outcomes for managing sleep-wake disorders. If you suspect you may have a sleep-wake disorder, the first step is to talk to your doctor. They can assess your symptoms, rule out any underlying medical conditions, and recommend appropriate treatment options. In addition to medical professionals, there are numerous resources available for people with sleep-wake disorders. Support groups and online forums can provide a sense of community and valuable information. Remember, you are not alone in this journey. Seeking help and support can make a world of difference in reclaiming your sleep and improving your overall well-being. Sleep-wake disorders are common and can significantly impact our physical, mental, and emotional health. Understanding these disorders, their causes, symptoms, and treatment options is vital for ensuring restful nights and productive days. By prioritizing sleep, practicing good sleep hygiene, and seeking professional help when needed, we can unlock the mysteries of sleep-wake disorders and embark on a path toward healthier and more fulfilling lives. Thank you for taking the time to learn about this important topic. Remember, sleep is not a luxury. It's a fundamental pillar of our well-being.